Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today are the founders of Override. How are you both doing today?
Great.
Thanks for having us on, Jared.
Yeah, I'm excited to have you both here. Let's dive right into it. Would love if you could each give your background, your title, and then we'll dig into learning more about Override here today.
Sure. My name is Jennie Shulkin. I am the co-founder and CEO of Override. Before we talk about what Override is, briefly on my background, I'm a criminal lawyer. I went to Harvard Law School and then worked as a prosecutor and a defense attorney before I transitioned into healthcare to co-found Override with my dad, sitting here. And the reason why I transitioned careers and started building this startup is because of my own complex chronic pain syndrome. When I was in college, I suffered 2 traumatic brain injuries. And shortly after we thought the second one healed, I started developing chronic pain in my neck, which shortly spread to my back. And over the past 9 years, it's spread to multiple other parts of my body. So at this point in my journey, I have pages and pages of interventions, devices, medications, physicians that I've attempted and have failed to find relief from, and we've learned a lot about the chronic pain care industry, enough to really become experts and to start a company trying to fix some of the broken elements of it.
Great. And I'm David Shulkin. I'm Jenny's dad and co-founder of Override. And most of my experience comes from being part of Jenny's journey. And I think that for so many people, particularly those who have been in healthcare as a healthcare professional, I'm a physician and internist, they don't really get to understand what the experience in healthcare is like until they go through it themselves or their family goes through it. And I've spent a career in trying to fix the problems of healthcare, and there are many problems that are worthy of fixing. But when you talk about how patients with chronic pain get help in our healthcare system, that's one of the problems that rises to the top. It is a broken system with lots of unintended and bad consequences when people don't get the right type of care. And this is so important to literally millions of Americans that we went to try to help find the solution to what's really a very complex problem, a public health crisis in this country.
And I have to ask you, since you're both here, we've had a lot of couples on. I think you're the first father-daughter like founding duo. How has it been uh, from both of your ends, right? How does it feel to work with your daughter, and then how does it work? How does it feel to be working, every day with your father?
Well, let's be clear. Jenny is the CEO and the boss. And there are many times that she has said to me that if I wasn't her father, that she thinks she'd probably fire me. So she runs a tight ship, and she's very demanding. And, I've grown used to that role.
Um, if, of course, working with someone so close to you comes with its challenges, but I was actually thinking about this last night that, the highest highs so far of this journey have been moments that we've been able to enjoy together, going to healthcare conferences together and seeing my dad's world through my own eyes, and getting to speak in front of groups of healthcare executives together. So it's been a privilege, and of course, also challenging when you don't have normal boundaries and walls between you and your co-founder.
I do this as a video for if anyone's watching this video after. Jenny smiling when you said that there's times where she probably wants to fire me was the funny. Your smirk was, that's all I needed to see. That's hilarious. Well, let's go back to Override. Give us an overview of where you're at today. I know you. I think you came out of stealth mode. It was a couple months back, right? And then raised some funding. Talk us through what that whole experience has been like and where you're at today.
Well, so first, maybe we'll just explain Override's basic model for our listeners. Override is interdisciplinary chronic pain care for people on a virtual platform. So essentially, each patient who comes to us gets assigned a care team of a pain physician, a pain psychologist, a chronic pain trained physical therapist, which is not a normal physical therapist, and a certified pain coach. And all of these providers work individually with the patient, and they also work together as a team to help identify barriers for progress and to inform each other's care. That team based approach to care is really what makes us different. It's, research has confirmed that when providers work together as a team, patients do better. But for the most part, in traditional chronic pain care, it's providers operating in silos. It's the physiatrist doing injections. It's the psychologist doing psychotherapy. It's the physical therapist not talking to either of them. And that results in a lot of inconsistent messaging and inconsistent treatment plans. So getting providers to work together as a team, especially from a whole person perspective, since chronic pain is such a complex issue that isn't just biomedical, but it's also the psychosocial, makes the world of difference in getting results for people with chronic pain. Where we are as a company is about a year ago, we raised our seed round from Seven Wire Ventures, Martin Ventures, Signal Fire, and a couple others. We have since gone from a team of basically the two of us to a team of essentially 25 with additional provider networks on top of that. We are building technology. We're forming partnerships with health systems and provider groups. We're actively engaged in planning for major payer pilots. And as you mentioned, we officially opened our doors publicly and announced ourselves, came out of stealth mode on December 15th, and have been, letting patients come find us and have been treating patients and validating that this model does work.
Yeah, it's been interesting to follow along since you came out of stealth and see where you're at. And I've heard some good things from people in the space that they're like, did you? Because people always ask us if we've heard about someone even before they come out of stealth, and you really flew under the radar for a bit, which is not easy given both your backgrounds and everything too. So kudos to you and the team for doing that. But I would love to hear too how your previous experiences have helped in building Override. So, Jennie, you were talking about you were a criminal lawyer. What parts of that do you feel that you've been able to leverage? I know it's different, right? But I'm sure there's pieces to it that's helped. And then on your end, spending time at the VA, right? How did that experience help in building this out? So maybe we'll start with you on the VA side, since we just gave Jennie the last question, and then we'll kick it back to her.
Yeah. My entire career, I've been running healthcare systems. My last job happened to be running the largest healthcare system in the country for two different presidents. So, but what we are trying to do does not come natural to medicine. Think about the last time that anybody who's listening had a team around them. This is not what they teach us in medical school or any health professional school. They teach you how to be good at what you individually do, but there's not a lot of team or collaborative approach. It turns out that when it comes to chronic illness, and in particular chronic pain, people do need a biopsychosocial support team to get through what is a very complex problem. So we're trying to go against the natural order of medicine, of the way that we're organized. And in fact, the fee-for-service payment system is designed to keep people in silos, to keep people doing individually what they're doing, not in terms of group care. So it's really the background that I've had, and lastly, the experience that I had being the secretary of the U.S. Department of Veteran Affairs, where because we aren't paid on a fee-for-service system, we get our money from Congress to take care of our country's veterans. I saw the power of organizing healthcare teams together around patients in need. And I saw how effective that was, particularly for chronic illness and chronic pain. And that's really what we're trying to deliver to the rest of the American population. for them to see how powerful this model is, how broken our current system is. And of course, as you know, convincing anybody to wake up in the morning and to change the way that they've been doing things for the last 10, 20, 30 years is not easy. So we know we are in a really, really challenging space, but we think it matters. We think people's lives depend upon this, and we're committed to that mission.
And from my perspective, I don't think that being a lawyer has translated really whatsoever here. Being a lawyer means following rules and regulations and standards, and everything that I was taught to do as a law clerk, a prosecutor, a defense attorney was based on years and years of tradition and protocols that were already set out. Being an entrepreneur is the exact opposite. Being a trailblazer means uncharted territory and having to push partners, customers, payers in a direction that they're not used to going in, that they've been following protocol for 30 years and now I'm asking them to change it. So it's an entirely different skill set. And, I basically had to start from scratch, learning the language of entrepreneurship, learning about business, learning about managing a large team, even words like equity and venture capital weren't words that I really knew the definitions of when we started this. So, but of course, my experience as a patient is what I draw on every single day, and that has been absolutely invaluable to our team. It's my story that speaks to other patients, that speaks to customers, and that helps recruit team members because I have a mission that we believe in because of what I've been through personally.
And with that experience, right, and everything put together, right, this awesome duo you have here, talk me through what the future looks like. You're part of the future. What you've already built, what you're continuing to build, what you're putting together. But talk me through the future of dealing with chronic pain. What you think it could look like, and let's maybe say in an ideal world.
Well, let's be clear. Our current system encourages the use of interventions, injections, infusions, medications, surgeries, and all too often dangerous medications like opioids. And so, what we're trying to do is we're trying to say, take a look at the science when it comes to chronic pain. Those actually are not the most effective treatments. We believe that the new science shows that this is involved in addressing the central nervous system, in addressing neuroplasticity, in helping to rewire the pain pathways that are in the central nervous system. And there are more effective ways of doing that than what we've been doing for decades. And so we're really looking to begin to change the standard of care in how pain care is delivered in this country. And we hope to be part of that push towards this change. Not that we believe that Override can in any way do that alone. We want others to join in their own efforts to start treating patients differently.
But in terms of what this could look like in the future, we would like to expand this to the entire country if possible. One of the very difficult things about running a virtual first company that's venture backed is that you not only have to comply with the laws of one state, but you have to comply with the laws of many states. And one of the reasons why there's essentially no other company doing what we're doing, having multiple specialists in one place working together as a team, is because with each specialty that you add another layer of complication. So we're having to comply with regulations and laws for 4 different specialties, each of which are different and each of which are different from each other in different states. So, getting through these hurdles and barriers to expand this as wide as possible is what we see for the future.
And in terms of just also for Override, what's next that you can share with us here today that's really exciting, both of you? You've had a interesting couple months, right? A lot has happened. What can we expect, I guess, as we head into almost, or we're heading out of Q1 now, right? Almost into the second half of the year. What can we expect for Override?
Well, we're continuing to look for partners to be able to help treat the patients that they care for. We are not a model that is looking to replace our current health care system. We want to partner with primary care physicians, pain physicians, payers, employers to be able to actually help people who are in their organizations get better faster and more effectively. So this is about us being able to scale what we're doing and then being able to demonstrate the value of what we're doing in terms of outcomes and also in terms of reducing the cost of care from the current standard.
Well, I'm really excited to continue follow along the Override journey. I'm glad we were able to have you on. Hopefully, we can have you on again in the near future. Give us an update on where you're at and cover some other topics.
Great. Thank you, Jenny.
Thanks so much.